In 2014, the UNAIDS set out targets with the objective to help end AIDS epidemic by 2030. This was supported by the global 90-90-90 target by 2020 and 95-95-95 target by 2030. The World Health Organization therefore introduced the concept of offering differentiated services delivery model as a means to bring this target into reality. Differentiated service delivery, or DSD, is a client-centered approach that simplifies and adapts HIV services in ways that serve the needs of people living with HIV better and at the same time reduce unnecessary burdens on the health system. Differentiated models have been driven by the need to provide client-centered services according to three elements. First, subpopulation elements which focus on the differing needs of various demographics, for example, gender or age, as in the case of pregnant women, breastfeeding mothers, adolescents, and adults. Second, the geographical element which considers whether a client is from an urban or a rural, social, economic, as well as accessibility to health services. Third element focuses on the clinical stability of patients based on their viral suppression to determine if they are stable or unstable. Lesotho adopted differentiated service delivery models to improve case identification and to improve retention on care of people living with HIV. This was done to achieve sustained viral suppression in order to reach epidemic control. This video therefore portrays some of the differentiated service delivery models that were implemented by the Ministry of Health in collaboration with the Elizabeth Glaser Pediatric AIDS Foundation, or PEPFAR, with support from PEPFAR. HIV testing services, or HTS, is a gateway to HIV prevention, treatment, and care. Identifying cases and linking people to care remain core in the fight against HIV. Self-testing is considered as a screening test, and if it is positive, another confirmatory test should be conducted by a healthcare worker in the facility. With the global outbreak of COVID-19, most of the HIV services were disrupted as social distancing was implemented. This disruption also affected HIV testing services. Lesotho is amongst the countries with the highest HIV prevalence at 25.6%. This means that it was critical to continue the work to identify people living with HIV and link them to care. HIV self-testing therefore became more crucial during the time of the COVID-19 pandemic, and the kits were also distributed to scale up index testing and partner notification in order to test those individuals associated with people who test positive for HIV. Founded through a mother's love and determination, PEPFAR is driven to see a world where no other mother, child, or family is devastated by HIV. Ending this epidemic, however, won't happen with a narrow focus or in isolation. It requires access to prevention, treatment, and support to all members of the family, from children to adolescents, mothers and fathers at all stages of their lives. Adolescent and young people-friendly health services model is one of the models that the ministry, in collaboration with PEPFAR, implemented to retain this priority population in HIV care. Among common features of adolescent-friendly services entail formation of clubs or peer support groups for adolescent and young people living with HIV. These clubs have helped adolescents better adhere to treatment, be retained in care, and achieve viral load suppression.
Okay.
During their clubs meetings, adolescents and young people share experiences and empower their members to adhere to treatment. This is done through, but not limited to, empowering them to accept their HIV-positive status, to have confidence to disclose their status to their family and friends, to provide psychosocial support, to fighting internal and external stigma and discrimination, and discussing issues pertaining to sexual reproductive health, maintaining hygiene, and good nutrition.
Na ke member ya Adolescent Corner, ke sebeletswa Squad Hospital. So ke tsebile boemo ba ka 2017. Now ke muimana, ke lebelletse le firstborn ya ka. Ke khuwe sephetho sa ka sa madi ka February. Ya ba go fungwana hore se less than 20. So hona jwale ke keta go khuwa sephetho sa ka sa madi go fungwana hore virus mmeleng wa ka is lower than detectable. So ke happy hobane ngwana ka o na le possibility ya hore a ka hlaha a le negative asina HIV.
I work at PEPFAR as Adolescent Priority Population Advisor, where basically I work with adolescents. So we at Adolescent Corners, it was the initiative that was provided by Ministry of Health in collaboration with PEPFAR, where we do some lot of services. The following are a core package that we do offer. One, case identification. In case identification, optimizing use of self-test and also providing provider-initiated testing. And other thing that we do is linkage. We are trying as much as possible for adolescents who tested positive, they should be linked to care so that they can be initiated at once. And also we do provide treatment. We have different methods of treatment. You can talk about SRH services, you can also talk about family planning commodities, and also you can talk about test and treat ARVs. And other thing that we do is retention. So one of the strategies that we use for retention, we use peer support groups. Peer support groups is where adolescents gather on weekends to have some sessions. So one of the sessions or topics that are covered in those sessions, we cover stigma discrimination, we cover issues of adherence, we cover issues of SRH, and also we cover issues of disclosure. So other thing that we do, we also do viral load monitoring. One of the main key for us is to achieve 95 strategy by 2030. So one of the key issues that we do is viral suppression. When our adolescents should be virally suppressed, undetectable, and transmittable. Thank you.
During the COVID-19 outbreak, community antiretroviral or ART delivery was introduced by the Ministry of Health to improve patients' access to their medicine in the context of COVID-19 and decongest facilities. The community ART delivery is provided to stable patients who have consented to the model because of their busy schedules or because they have missed their drugs refill appointments due to lack of transport and other factors. Individuals eligible for community ART delivery are required to be older than 15 years, be virally suppressed, and have completed at least 6 months of treatment. Patient tracking for community delivery is conducted by ECPAF's community partner, LENASO, while community outreaches are implemented by healthcare workers. We can't afford to lose our clients, so we now do same-day follow-ups for those who miss appointments and deliver their treatment in their respective community during outreaches.
LENASO is the Lesotho network of 8 service organizations. We are a community partner for the Ministry of Health. And basically what we are doing is to create demand and do community mobilization. This is whereby we encourage the community members to seek health services at facility level. And the other critical part that we are doing is to ensure that patients are retained in care. We do this in collaboration with the healthcare workers at facility level and also health retention supporters who are the national site level staff at facility level. Basically what happens is that patients who are on ART are appointed to come for their checkups on a daily basis, and once a patient misses her appointment, normally what happens is that the facility will give the LENASO personnel, in this case health retention supporter, the name of that particular patient so that the patient can be tracked. So when you do tracking, we do it in 2 ways. One, we do it through a phone call for those patients who are accessible by phone. We'll call them to find out why they missed their appointment, or if we can't access them by phone, we call their village health workers to identify why they missed their appointment. And if we can't reach the patient by phone, we go to the community to do what we call physical tracking. And then when we get home, we look for the patient, and then if we find the patient, we find out why the patient missed an appointment. Even through the phone, we also do the same of establishing why the patient missed an appointment. And more often than not, most reasons why patient missed the appointment includes some will be in RSA, some will be at school, at work, some will be temporarily away. We also have some who are having some transport problems. And in this case, for the ones who are having transport problems, since the Ministry of Health has approved what we call community distribution or community delivery, this is whereby we take medication from the facility to the community for patients. We normally get back to the facility to give feedback why the patient missed an appointment. And for those whom they missed because of transport problems, we sit down with the facility to see whether we can take the medication from the facility to the homes of that particular patient. And then if it is agreed, we take the medication, we take necessary documentation, and then we distribute the medication to the patient at home. The patient will sign to acknowledge that he or she received the medication, and then we get back to the facility to give feedback, and the facility tools will be updated, and the patient will be given another appointment when he or she will come back to the facility. Basically, this is one of the strategies which is being used now to ensure that patients are retained in care.
PEPFAR is committed to support the Ministry of Health in the fight for an AIDS-free generation. We are committed to see a world where no other mother, child or family are devastated by HIV. We closely monitor pregnant mothers to ensure that they deliver babies that are free from HIV. And we implement mother-baby pairs to ensure that HIV-infected babies receive the appropriate HIV care and management. Adolescents and young people are a vulnerable population that requires customized care in order to ensure that they have access to health services. The Ministry of Health, in collaboration with PEPFAR, are implementing adolescent and youth-friendly health services that ensure that this population has access to HIV prevention and treatment services. We closely monitor them to ensure that we are able to retain them on care and ensure that they are virally suppressed.
The United States government, through the President's Emergency Plan for AIDS Relief, has been fighting against the HIV/AIDS epidemic here in Lesotho since 2007. Our strong partnership has allowed us to take concrete actions towards reversing the course of the epidemic. We will remain here side by side with the government of Lesotho as well as partners until epidemic control is a reality. To achieve HIV/AIDS epidemic control, PEPFAR has been working directly with communities to ensure that all ages, genders, and at-risk populations know their HIV status, receive life-saving HIV prevention and treatment services, and are virally suppressed. For us, this means delivering quality, client-centered care that meets patients where they are and with what they need. Differentiated Service Delivery, or DSD, is a core PEPFAR strategy to ensure that all patients are successful in their care. Currently, one of the main challenges is maintaining patients on continuity of treatment. DSD models such as multi-month dispensing has helped our patients by providing them with accessible treatment and therefore improved outcomes. Differentiated service delivery could not have happened without the strong partnership with the Ministry of Health and partners like the Elizabeth Glaser Pediatric AIDS Foundation. PEPFAR is proud to work very closely with these partners to ensure that every patient is a success.
The differentiated service delivery models has contributed to the gains achieved in reaching epidemic control. The treatment disruptions challenges brought by COVID-19 led the ministry to scale up its 3 to 6 month ART multi-month dispensing, and pre-exposure prophylaxis multi-month dispensing. The impact of the multi-month dispensing was significant as clients were able to achieve active treatment and be retained even during the lockdown and even when they worked far away from their homes or even outside Lesotho in the mines. We therefore would like to thank our partners and donors for joining the ministry in the fight against HIV and AIDS.
The Ministry of Health thanks all partners for joining hands in the journey towards reaching epidemic control in Lesotho. This is our journey to reduce mortalities related to AIDS and reduce new HIV incidences. This is our success. PEPFAR thanks the Ministry of Health for providing the opportunity to support the HIV response in Lesotho and expresses its gratitude to PEPFAR for the continuing partnership in funding the HIV program in Lesotho.